Novalgin tablet contains the active ingredient metamizole sodium. Metamizole is a non-narcotic pyrazolone derivative with analgesic, antipyretic, and spasmolytic effects. Novalgin tablets indications: severe or life-threatening fever, cancer pain, not used as a routine analgesic. How to use? Generally, the dosage is based on the desired effect and patient's condition. The effect of Novalgin sets within 30 to 60 minutes and lasts for approximately 4 hours. Unless otherwise directed, the following dosage guidelines should be applied. With oral application, the single dose for all age groups is 8 mg to 16 mg metamizole per kilogram body weight. For children with high temperature, a dose of 10 mg metamizole per kilogram of body weight is usually sufficient. Multiple dosing. If the effect of a single dose is inadequate or has subsided, the dose can usually be administered up to 4 times a day. The lowest pain and fever controlling dose should be selected. Generally speaking, in adult, 5 grams metamizole per day or 70 mg metamizole per kilogram body weight in 24 hours should not be exceeded unless special clinical circumstances make this necessary. Dosing in patients with renal or hepatic impairment. As elimination rate is reduced in impaired kidney or liver functions, high doses and long-term use should be avoided. For only short-term use, it is not necessary to reduce the dose. No data is available on the dosage for long-term use. Consideration must be given to the possibility of such impairment in elderly patients and patients whose general state of health is poor. Duration of use. The duration of use depends on the nature and severity of the disorder. In relatively long-term treatment with Novalgin, regular monitoring of blood pressure inducing differential blood count is required. Method of administration. For oral forms, it is best to swallow the tablet with sufficient amount of liquid, about half to 1 glass. Contraindications. Novalgin must not be used in patients with allergy to metamizole or to other pyrolyzers or to pyrazolidins, including, for example, previously experienced granulocytosis to one of these substances. Impaired bone marrow function. Following cytostatic treatment or diseases of the hematopoietic system. Patients known to develop bronchospasm or other anaphylactoid reactions, urticaria, rhinitis, angioedema to analgesics such as salicylates, paracetamol, diclofenac, ibuprofen, indomethacin, naproxen, allergy to any of the excipients of Novalgin, acute intermittent hepatic porphyria, risk of induction of porphyria attacks, infants under 3 months of age or 5 kg body weight. In infants between 3 and 11 months of age, Novalgin must not be injected by the intravenous route. Novalgin must not be given parenterally in patients with hypertension or a stable hemodynamic. Precautions and warnings. Metamizole metabolites are excreted into the breast milk. Breastfeeding must be avoided during and for 48 hours after administration of Novalgin. The following patients are at special risk for possibility severe anaphylactoid reactions to metamizole. See contraindications. Patients with bronchial asthma, particularly those with concomitant rhinosinusitis polyposa. Patients with chronic urticaria. Patients with alcohol intolerance. Patients requiring to even minor quantities of certain alcoholic beverages with symptoms such as sneezing, lacrimation, and pronounced redness of the face. Alcohol intolerance may be indicative of a previously undiagnosed analgesic asthma syndrome. Patients with intolerance to dyes, tartrazine, or to preservatives, benzoates. Before Novalgin is administered, the patient must be questioned specifically in patients found to be at a special risk for anaphylactoid reactions. Novalgin must only be used after carefully weighing the possible risk against the expected benefit. If Novalgin is to be administered in such circumstances, close medical supervision is required and the facilities for immediate emergency treatment must be available. Side effects. Side effect of Novalgin tablet can include increasing heart rate, nausea and vomiting, stomach pain, difficulty in swallowing, dry mouth, dizziness and drowsiness, headache, skin rash, itching, pain at the injection site.